To be a franchisee investor, one need not have a medical background. Because of you, those lives are being saved. Well, to be a franchisee investor, one need not have a medical background. Whatever may happen in ICU, ultimately it is related to billing and revenue. No? We usually provide an app for that ICU, for that franchisee investor, where one can check how many admissions are happening, how much bills are being paid under each category, like consultations, for bed charges, ventilator charges, monitor charges, nursing charges. Under each category, how much money is being collected. There will be a linked bank account, okay, and app will be there. So one can easily check what's going on. That is one thing. One cannot do any hanky-panky business inside ICU because everything is also monitored by whole hospital as well as authorities also now. It's about the life and death of the patient. So the clinical teams over there will manage the patient. The administration teams, especially the billing department, will do the billing for the patient. So one will get that entire data. As a franchisee investor, you will also be requested to participate in the social activities because we want you to get that reputation. You should not be hiding somewhere because of you, those lives are being saved. Okay, so we request you to participate in the social activities where we do some community education programs, some events that we do. Okay, so which those details our teams will communicate to you eventually. And as far as the ICU is concerned, we also request you not to barge into the ICU as and when you want to do, because it's ICU. You may not receive information about the patient care. It's because it's privacy, right? Just because I'm the owner of the ICU or I'm the owner of the hospital, I cannot know everything. No, it's a confidential information between the treating physician, treating nurse, and the patient. So that part one has to understand. The franchise investor even be a doctor, but when you are not involved in the care of the patient, you will not receive the health-related information. Whether that patient is suffering from, let us say, some disease, or patient is suffering from some terminal illness, several things will come into play. Especially we manage medical legal patients. Whether somebody consumed poison and came, okay, why would that information be informed to everybody? No, that is patient confidential. That cannot come. There are some legal entities which come into play as far as healthcare is concerned, especially in ICU. So that one has to follow. So that part you don't need to worry about because it is under law. About the financial things, as I said, it will be absolutely transparent. Okay? As far as it is related to you knowing the information, as I said before, you will know the statistics, numbers, not each patient's information. It applies to both healthcare related and non-healthcare related franchises. But as I said before, it's related to the social activities, outside activities, community activities, you are welcome to participate. In fact, we will pull you to participate into those things because we want you to be known to the community. Your work should be known to the community.